My name's Gall. I'm a consultant cardiologist at King's College in South East London. Right, so postural tachycardia syndrome does have a very specific definition, which is if a patient's heart rate increases and is a sustained increase by 30 beats per minute or more over a 10-minute period, and they have symptoms, then they are said to have postural tachycardia syndrome. So it is a group of symptoms that patients suffer when they stand for a period of time, they feel unwell, and they feel better when they lie flat. At the moment, we don't have a true understanding of exactly what's wrong with their blood pressure control system. We just have an idea that there is something wrong. In terms of diagnosis, we want to see that their heart rate increases when they stand, but also it is associated with symptoms, and also we try to make sure that they don't have another condition underlying, for instance an infection or an overactive thyroid. We also want to make sure that they don't have a heart problem, and that may involve a number of cardiovascular investigations. From the perspective of treatment, it's very important that we understand that there is something wrong with their blood pressure control system, and we need to get them to fill up their blood vessels by drinking more water and adding more salt. Sometimes it's a failure of their blood vessels to tighten up properly, and so therefore using compression clothing can assist. And often patients become unfit, they become deconditioned, their heart gets smaller, their blood volume gets smaller. So improving that by exercise, a gradual and slow increase in exercise, can make a significant difference. And often it's that that is the most important aspect for the therapy prior to use of any particular medications. Inappropriate sinus tachycardia is defined as a slightly different condition to POTS, in that this is an inappropriately raised heart rate, but it doesn't necessarily rely on the patient standing. So it may be persistently raised, whatever the position the patient is in. Whether there is truly a significant difference in the patient who has IST in comparison to POTS is uncertain, because we don't really truly understand what's wrong in all of these situations. However, there's a particular focus that their heart rate is inappropriately fast, and so therefore we may focus more after lifestyle interventions on heart rate slowing medications such as beta blockers, such as diltiazem or verapamil, and perhaps specifically ivabradine, which does have a license in this area, or I should say is indicated in the guidelines. It's not licensed, certainly in the UK, for that use, but it is in the international guidelines for use. There has been a vogue in the past for sinus node ablation, so burning away the sinus node and perhaps even needing to have a pacemaker put in, but at the moment the data is relatively thin in understanding that that is helpful.